Yelling with everyone. Welcome to today's webinar on becoming stroke smart. We have some wonderful panelists today who will be discussing topics such as risk factors, treatment, and life after stroke. Before we start, I'd like to share a land acknowledgement. We acknowledge the Indigenous peoples of all the lands that we are situated on today. While we meet today on a virtual platform, we'd like to take a moment to acknowledge the importance of these lands, the ancestral and unceded territory of all the Inuit, Métis, and First Nations people across Canada that call this nation home. Personally, I wish to acknowledge the land I currently occupy in Toronto. I live on the traditional land of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, which is now home to many diverse First Nations, Inuit, and Métis people. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. My name is Safina Allidina, and I serve on the National Health Promotion Team in the area of mental health communications. I'm excited to be moderating today's presentation alongside these wonderful speakers. We will start by learning from Dr. Brar about what is a stroke, what are the different types of stroke, risk factors, symptoms, treatment, and more. Then we will hear from Shabbir Dhalla, who will share his journey of experiencing a stroke. Finally, we will learn from Dr. Lakhoo about lifestyle changes to reduce your risk of having a stroke. Thank you so much to all of our panelists for sharing their expertise and experience with us. I also want to thank all the volunteers who have put together this webinar, and of course, a big thank you to all of you for joining and taking the time to learn about this important topic. By the end of this webinar, you should understand the risk factors associated with cardiovascular disease and how to reduce them. You'll also learn about identifying and treating stroke. We will also discuss how to improve the quality of life of people living with cardiovascular disease, along with lifestyle changes that you can make to be healthier. Finally, you'll also have the chance to learn from shared lived experiences about stroke. Before we get started, please keep in mind that any information provided in this webinar should not be considered medical advice and is not intended as a substitute for medical professional help, advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions that you might have about your medical care. Now it is my pleasure to introduce Dr. Brar. Dr. Jaskiran Brar is a stroke neurologist based out of Fraser Health. She spends her days focusing on the acute treatment of stroke patients who present to the hospital, as well as creating a plan to help reduce future risk of stroke. She works with a team of stroke nurses, physiotherapists, neurology pharmacists, speech and occupational therapists. Thank you for being with us today, Dr. Brar.
Thank you guys for joining me for this talk. I'm really grateful that I'm able to do a talk that's going to help a lot in primary prevention because, as Safina said, I do a lot of acute stroke care and secondary prevention. So it's really nice that I'm going to be able to reach out to the community to try to help prevent this in the first place. So why are we here? So up to 80% of strokes can be prevented. This is a huge percentage. So we really want to try to do everything we can before it actually happens. In Canada, there's a stroke every 5 minutes, and it's also the leading cause of disability in Canada. Currently in Canada, there's approximately 400,000 Canadians that are living with the effects of stroke. And half of people that have a stroke require help with their daily activities. So you can really tell that stroke is quite devastating and debilitating for patients. So that's why we're trying to do everything we can to try to prevent this from occurring in the first place. So what are my risk factors? So it's really important to sit down with yourself and also with your family physician to try to identify what your risk factors are for stroke, heart attack, and really everything. So there are certain risk factors that are modifiable. So those are the ones that we really want to be able to try to change. So kind of going through this list, we have high blood pressure, atrial fibrillation, diabetes, cholesterol, sleep apnea, unhealthy diet, physical inactivity, smoking, and alcohol. And there are some things that we can't change. As we know, age, we all get older, sex, family history. And if we've had a previous history of TI or ischemic stroke, that's going to increase our risk of a future one. Also, our ethnicity and social determinants of health. This is kind of a general map that shows us our lifetime risk. You can see that there are differences in different populations. So there's two types of main strokes. I'm going to go over the main types. The first one is ischemic stroke. This is when you have a blood clot, and you can see right here, it's a blockage. So this is when we don't get blood flow past the area of blockage, and this can happen from a buildup of plaque or a clot going into the brain. The second type of stroke is what we call a hemorrhagic stroke. So you can see here, these small little arteries, they get weakened, in particular with high blood pressure. And because they're weaker, they rupture and can cause basically a ball of blood to form inside the brain. So in terms of symptoms, though, most strokes will have similar symptoms because they affect the brain tissue that's there, either through a blockage or through the bleeding. So what we really look for is anything that's really a rapid change. So kind of 1 minute you're normal and then the next minute you're not, or if you went to bed one way and then you woke up a different way. So we look for things like, is our face drooping? Is there any weakness in one of our arms or one of our legs? Is the speech slurred, or does it not make sense? Other symptoms of stroke can be if you have double vision that starts all of a sudden, any numbness. Really, the key thing is the symptoms tend to be on one side, and really they're rapid onset. So anytime you have one of these symptoms, it's really important that you call 911 and get to the emergency room as soon as possible. And the reason we want you to get there fast is because all of the treatment options are very, very time limited. So one of the treatment options for us is clot busting medications. This can be given within 4.5 hours of arrival. So it's really important that as soon as you notice the symptoms, you get to that ER so you can see if you're a candidate for this medication. And this is given IV, and then you'll be monitored over the next 24 hours to make sure you don't have any of the side effects, such as bleeding. Another option for treatment is something called endovascular thrombectomy. And this can be an option for a small patient population. And this would be for people who have big blood clots that have occurred in the brain. For this, it can be a little bit longer in terms of time. So you can go up to 24 hours. So I want to show one of these videos. So what you can see here is that there's a blood clot inside the brain. Okay, so this is someone with a clot in one of the bigger arteries of the brain. So what they do is when you present to the emergency room, they take you to the angio suite and they're able to put a catheter in through the groin. So this is very minimally invasive. And with that catheter, you can see they go all the way up past the heart and into the brain. And what they're trying to do here is trying to get that clot out. So they've created technology now where we use stents kind of similar to in the heart, and we place those stents. As you can see here, they're bringing in that catheter, and we're going to see them place the stent within the clot. They allow the clot to kind of get enmeshed within the stent, and we'll see that getting pulled out right now. And then what they do is they use suction power and they try to pull that clot back within the stent. So they're not leaving anything in the brain, but they get that clot out. And here you can see that that blood flow is returned. And that's really what the goal of this procedure is. Now, like we mentioned before, you really, really want to get there as fast as possible, because while that blockage is there, we're losing brain cells. We're losing 2 million neurons for every minute. So you're going to often see, if you ever do go to the ER, it's very, very rapid and rushed in the beginning. You're going to see the doctors are really going to ask you some of those basic questions, and they're trying to get you to your treatment as fast as possible. And the reason for that is because every single minute counts for our brain. Now, post-stroke. So this is once we've had a stroke, we've gotten through that initial phase. Really, the most important thing post-stroke is time. That gives us time for recovery, but also rehab. So it's really important that you engage with your allied health, your physios, your occupational therapists, your speech therapists, and try to get them to give you exercises. In the beginning, there can be quite a bit of fatigue. So you really want to be mindful of your body because only you know your body, but you want to try to engage as much as you can with therapy because that's really the only treatment that we have for recovery. There's no real medication to help reverse once the damage is done, but with rehab, you can have improvement from weeks, months, and some people can have it even longer. So it's really important that you engage in this and really try to give it your best shot because that's really what's going to give you your most recovery. So aphasia, this is when patients' language gets affected. A lot of times people will think that they're confused, but really it's the inability to understand and to be able to speak. So we really want to have access to a speech language therapist who will give you exercises. And oftentimes we feel very frustrated because our speech is not normal, so we don't want to talk. But it's really important that we do because that's where we're going to get the recovery. The next thing is dysphagia. So this is when we have difficulty swallowing. So this can be quite tricky. So a lot of patients in the beginning will have severe dysphagia, and with time it can improve. And it's really important, of course, because we need to be able to eat, we need to be able to drink. So these are things that we're very mindful of in the beginning. And we also have to be very careful with dysphagia because if we start eating when we shouldn't, we can get pneumonias because the food goes down the wrong pipe. So other things we have is, of course, the weakness. You can have weakness in the arm and the leg. And this is where the occupational therapist can help you work with fine grip movements and the small, fine things of the upper extremity and also cognition. And the physiotherapists are there to help you try to figure out how your balance can improve. Do you need any walking aids? Because we really want to make sure you're not falling and you're best supported in your independence and mobility. So one of the other complications can be spasticity, and this can be really quite uncomfortable. 25 to 43% of stroke patients will have spasticity in that first year. So imagine this feels like a really tight muscle being pulled. So it's really important that one, it gets identified, and then we try to treat it for patients. Because as you can see here on this slide, when we're having spasticity, it's going to cause our arms to contract and our joints to contract in different positions. So that can affect our balance and our posture, can also affect our hygiene. There's medications that can be given. There can be Botox sometimes that can be injected. Your physio, your OTs will recommend range of motion exercises. So this is something to keep an eye on and try to be mindful of to have it treated and try to do the things we can to help minimize and prevent. Now, this is really what we're here for, is how do we prevent another stroke from happening? So high blood pressure, this is the number one risk factor for strokes. And like we talked about, 80% of strokes are preventable. So we really want to make sure that we're following up with our family doctors to find out what is my blood pressure target? What should it be? And then making sure that we achieve those targets because that's going to help us reduce our risk of a future stroke from happening. Now, in terms of blood pressure targets, that's a really important discussion to have with your healthcare providers because everybody can be a bit different based on their age, their medical conditions, and what type of stroke that they had. One of my favorite websites is the Hypertension Canada blood pressure log. I included that on the last page on the resources, and it has a really nice video on how to check your blood pressure. I think you guys have gone over this in the cardiovascular webinar as well, but I just want to reiterate that and explain how important it is that we are monitoring and checking appropriately and getting to the goals that we need to get to, because it is the number one risk factor. Next, we have something called atrial fibrillation. So this is an irregular heart rhythm. It's approximately 20% of the strokes that we see in the community. And these strokes actually tend to be really quite big and quite devastating. So it's really important that we try to do what we can to minimize the risk of a reoccurrence or even this happening in the first place. So you can see here on this diagram, in the heart, we get this irregular heart rhythm, and you can form clots because the blood stagnates. And those clots go up here through the arteries into the brain. The clot can go anywhere really in any artery in the body, but also can go to the brain. And that's where we get those really big, devastating strokes. So there is a treatment for this. It's called anticoagulation, and it can help reduce our risk by 70 to 80%. So that's a really big reduction. And we'll kind of go over some of those medications in a little bit. So blood thinners. These are, the mainstay of stroke patients, and this is ischemic stroke patients, not the bleeding stroke patients. For the ischemic stroke patients, you're going to most likely end up on either a baby aspirin, so aspirin 81 milligrams, or a medication called clopidogrel or Plavix. In the beginning, because the risk of stroke is so high in the first 21 to 90 days, you will sometimes require to be on both of them for 21 or 90 days, depending on how your stroke was. And then the key thing to remember, because patients often forget, is that after that 21 days, they'll stop both. But no, you should be on one antiplatelet. So you just want to confirm with your healthcare providers about which one are you going to be on long term. And once you've had a stroke, that will be lifelong, okay? The next thing is anticoagulation. So this is only for patients who have atrial fibrillation. So like we talked about with atrial fibrillation, big strokes, quite disabling. But we do have a medication that reduces that risk by over 70 to 80%. So what we have for this is something called anticoagulation. So this is also a type of blood thinner, but a bit stronger. You may have heard of some of them: warfarin, Xarelto, Eliquis, Pradaxa. Each one is a little bit different. One of the key points that I would like to say is that if you are on Xarelto, you need to make sure you take that with food. Because if we're not taking it with food, it just doesn't absorb as well. And then we don't get the same efficacy of it. So if you're on Xarelto, make sure you take it with food. And with any of the other medications, which are twice a day, any medication that is twice a day is twice a day because it comes out of your system. So if we miss a dose or two, it's going to come out of our system and we're at risk for forming those blood clots. So it's really important, in particular with these blood thinners, that you don't miss any doses because our risk of stroke can just shoot up with a few missed doses. Of course, we're going to need procedures and surgeries, so we do have to hold them at some time. But what we always want to do is make sure with whoever you have the surgery, when can I go back on this and how long do I need to be off of it? So the other thing we need to follow up with all of our healthcare providers is controlling our risk factors. So do you have diabetes, high cholesterol? If you have either of those, you want to follow up with your provider to see what is your target range. What can you do to get to that target? My recommendation always is we have the medications to help us for sure, but we always want to add on the lifestyle part. So the exercise and the diet, because that helps keep us on our lowest dose of medication and really reduces our risk altogether. It's also important to, for the lifestyle, decreasing our alcohol intake. If we smoke, stop smoking, exercise, and healthy eating. Another thing I wanted to go over is a lot of times we forget about this, but vascular cognitive impairment. This really is within the world of stroke as well. So part of vascular neurology. It's a disorder of the mind where, the mental ability to be aware, to think, slows down. So I want you to look at this MRI, and you can see here on the left, this is a normal MRI. You can see how full this brain is. When we come onto this side, you see these crevices, they're so deep compared to this side. This has happened because this patient has had atrophy. So the brain has shrunk because it's not healthy. And then you can also see all of this white stuff here, and you can see some of these little smaller holes. This is what we call white matter disease. And this is when the small arteries are getting affected. And this patient also has a few what we call lacunar strokes. So when all of this damage kind of adds up, we get something called vascular dementia. So 90% of people in Canada have at least one risk factor for heart conditions, stroke, or vascular cognitive impairment. So these are all the risk factors we kind of went over before. It's the same risk factors for the vascular cognitive impairment. So it's important for us to sit with ourselves and be like, what are my risk factors for this? and then try to work on those. So we can try to be proactive and prevent. So symptoms of vascular dementia can be very mild for some people and very severe. It can be forgetfulness, concentration, thinking, also changes in mood, and we just notice we may be slower overall. Now, in the most severe form of this, the vascular cognitive impairment can go into vascular dementia. So what can we do about this? It's really quite similar to the stroke management, which is if you've had a stroke, we're going to do all the same things there, but we really want to be more active, be smoke-free, try to aim for a healthy weight, sleep, manage stress, drink less alcohol. I personally love the sheet. I also added it in my resources. It's kind of the Canadian guidelines for exercise, movement, just what we should do for 24 hours. So we really want to try to get that 150 minutes of moderate aerobic activity per week, 2 times a week, trying to get some major muscle strength training, several hours of light activity, including standing. Really try to minimize our recreational screen time. I know we live in a world of screen time, and I know a lot of us work in front of screens. So maybe trying to minimize recreational screen time at home can be helpful, and really trying to get the adequate amount of sleep. So really prioritizing that for yourself. So these are all of the resources that are available. If you look on here, this is the Heart and Stroke website. It's great. It has a lot to do with cardiovascular and stroke reduction, including vascular and cognitive impairment. This was the Canadian exercise guidelines we talked about. This video is definitely worthwhile watching if you haven't seen it before, just on how to check your blood pressure. There's also resources post-stroke for Stroke Recovery BC, and also post-stroke fitness. There's FAME exercise. So if you're trying to find a way where you can be active, but you have some limitations, that's a really good website. And also Stroke Best Practices has some nice resources for post-stroke if you have had a stroke. Thank you, guys.
Great. Thank you so much, Dr. Brar, for your very informative presentation. It was really helpful to hear about the risk factors, the signs of stroke, as well as how it can be treated and prevented. And hopefully we can all be more aware of how to recognize a stroke in ourselves or our family. It is now my pleasure to introduce our next speaker, Shabbir Dhalla, who has kindly agreed to share with us his experience in living with stroke. Shabbir, thank you so much for joining us. We'd love to hear more about your health journey. Can you tell us more about your story, including how you felt when the stroke happened?
Thank you, Safina. I'm 64 years old, otherwise a very generally healthy individual. But unfortunately, I had high cholesterol. I had a heart attack 5 months before the stroke, and I have high stress. This happened to me 16 months ago on November 22nd, 2022, and it was undoubtedly the worst day of my life. It happened in Kelowna, British Columbia, which is about 450 kilometers away from where I live in Vancouver. While I was at work, I was at a hotel that I go on. And initially, I had the most incredible headache and neck pain that I'd never experienced before. And I therefore I recognized there was something going on, that I needed to get some help. And I called the manager over to call 911 for me. And while she was talking to her, I ended up vomiting. But evidently, I was coherent enough to tell the manager who relayed to 911 the medications that I was on. And I told her, let them know that I'm having a stroke. So instinctively, I knew I was having a stroke, even though I don't remember any of this. I was flailing, I was vomiting, and finally I passed out. When I woke up the next day, I found myself intubated and with my hands tied down so I wouldn't remove the apparatus. I spent 3 days at ICU at Kelowna General Hospital, and where I stayed for a total of 8 days. The symptoms were I had my right side was completely numb. Fortunately, a stroke affects everyone individually. Fortunately, I didn't have any paralysis, just numbness on my right side. There was tremendous muscle weaknesses. My speech was impaired quite a bit. I had double vision. I was dizzy. I had vertigo. I'd lost some of the filters for emotion. and my brain capacity was also very limited. However, in spite of all this, I was still coherent enough to know what was going on around me, and I was able to hear everything that was going on. Now, I was bedridden, and I had to swallow very carefully to avoid choking, and chew very consciously to avoid chewing up the right side of my cheek. My wife and son flew to Kelowna that night, and they were by my bedside. And my daughter, who had just started a holiday in New Mexico, decided to halt her vacation and be my bedside also the next day. You know, when my wife and I feel a bit uncomfortable saying this, but I'll say it anyway, that when my wife and my daughter had left the hospital room to grab a bite to eat, I called my son over and I told him in so many words that we had to figure out a way to end my life, because I just don't want to carry on anymore in that state. Anyway, I stayed 8 days at Kelowna General Hospital, and then I was air ambulanced to Royal Columbian Hospital, which is near Vancouver, which is where my home is. And I stayed another 10 or 11 days there. After that, I was transferred to a Queen's Park Rehabilitation Center, where I stayed for the next 3 weeks. Now, for the first 3 days at the Queen's Park Rehabilitation Center, I was crying all the time. I was crying, sobbing quietly, and I was really feeling this was a bad dream, and I was begging to God that to turn back the hands of time, because this was devastating, that I was completely numb on one side and unable to do so many things. However, after 3 days, I realized that this was my reality, and I had to decide to go very, very hard on rehabilitation. And I did physiotherapy, I did occupational therapy, I did hand therapy, I did speech therapy, and also had some gym time. And I would often ask for extra time at the gym anytime the bike wasn't in use, so that I would carry on giving 100%. Anyway, I was a victim of my own success, because 3 weeks later, they recommended, they had a COVID outbreak, and they recommended leave the facility. And I felt I still needed 1 or 2 more weeks of that lifestyle, of being at Queen's Park Rehabilitation Center, even though the food was quite a lot to be desired, but I still wanted to stay on a bit longer. And but because of the COVID outbreak, they compromised and they agreed to put me as an outpatient therapy, which basically means I live at home, but I go to them for therapy. Now, remember, I had double vision. I had a patch of one eye, and because of that, I could not drive. So I had to rely on my wife or my friends to take me to therapy, to outpatient therapy. In addition to that, and everything was such a tremendous, it was very difficult to even make a phone call, to talk took a lot of energy. But anyway, I somehow found a lady called Nicole, who's a physiotherapist, who was familiar with the vestibular part of your brain being affected. And I also went to her for therapy. In addition, I went to another organization called Abilities Neurological Rehabilitation. This deals specifically with neurological problems. And I would see the physiotherapist there 1 week, and I would see the occupational therapist there 1 week. Now, I combined all those exercises that were given to me by outpatient therapy, by Nicole, and by a physiotherapist and my occupational therapist. And I combined all those exercises, and I probably did 6 times what they recommended. My whole life revolved around rehabilitation. 10 weeks later, my vertigo became a lot better. So I could go from a walker to a cane. And 6 months later, my double vision corrected itself. Now, I don't know if it would have corrected itself automatically, or whether it was eye exercises I was doing daily. I went to work in Kelowna 5 months later, quite a bit earlier than I should have, but I did that on purpose because I wanted to be faced with problems and exercise my brain. My wife came along for the first trip just to make sure I would be fine on my own. And I got a lot of help from the staff, but I did manage it. And over time, things got way, way better to the point that I'm happy to be alive and almost living the life that I used to. That was 16 months ago. It was stroke was very tough physically, mentally, and emotionally. And that's my journey.
Wow, thank you so much for sharing that with us. There's definitely a lot there to digest. It sounds like a really challenging experience that you went through. I'm glad you were able to get help right away when it happened. And it's also helpful to understand more about your recovery journey and understand what did your experience look like there, knowing it may be different for everyone, but really helpful to understand the steps that you were able to take to get support.
Safina,
So I'm really happy to hear.
I would want to add a couple more things that I realized about 4 months ago that some good things have come out of this. What was the worst day of my life turned out to be one of the better days. My family today is a lot closer because of this incident. I received a lot of clarity about work. I had a false sense of security. I really thought I was the glue that kept things together. And I realized that after 5 months of not being there, and I originally thought my partner was going there because I'd given him specific instructions on what to do and where to find things. But I realized that the manager had told him not to bother coming, and that he was doing all that by phone and emails. And then I realized that maybe I can slow down a bit. I can afford to take it easy a bit. Before I was going to Kelowna every 2 weeks, and now I've just go once a month, so I can actually do a lot of things on this side, whether it's looking after my aging mom or whatever it may be. I realized that it really had a false sense of security. And other things that I changed was also I became less of a perfectionist. I used to be very much a perfectionist. I wanted everything to be 100%. And now I realize that 85, 90% is good enough.
Since your stroke, can you tell us more about what lifestyle changes you've made to support your health?
I'm a lot more kinder. I'm a lot more empathetic because of that. And my eating habits were good to begin with, but surprisingly, I became a lot more health conscious. I'll get to that a bit later on, but if there's time, but I became a lot more. My eating habits were good because I had colon cancer stage 3 14 years ago. And it was quite a tough thing to go through because I had operation, I had chemotherapy, and I had a study drug. But it was life-changing because it made me realize that life is too short and I had to make some changes. So I dropped 20 pounds and I started exercising more frequently. So my food, sorry, not exercising, but my food habits were a lot better, and my exercising also got better. But this time around, my my health, I became a lot more health conscious. I check my blood pressure every day. I go to the gym every second day. I drink lemon water practically daily. I often eat turmeric, even though I don't like the taste. I drink turmeric, honey, and lemon very often. I wear my night guard my night mouth guard every day. I take my vitamin D, my folic acid, my milk thistle to cleanse my liver and other supplements daily. I see my chiropractor daily. I see my registered massage therapy not daily, monthly. I see my registered massage therapist monthly. I see my physiotherapist every 2 months. And I've also seen kinesiologist that Dr. Brar had mentioned about spasticity. And I often see my cardiologist too. So I'm a lot more health conscious because of this incident.
Thank you so much for sharing that, Shabbir. It's definitely inspiring to hear how you've adapted your lifestyle after these events to improve your overall health, your quality of life. So I think something that we can all take back to think more about.
Thank
We're
you.
going to be learning more about lifestyle changes from our next speaker, Dr. Lakhoo. Dr. Sheila Lakhoo studied medicine at the University of Alberta and completed her residency training in family medicine at the University of Calgary. She moved to Toronto in 2008 to complete a master's degree in health sciences in family and community medicine with a concentration in global health at the Dalai Lama School of Public Health. In 2010, Dr. Lakhoo started an academic family practice at St. Michael's Hospital in Toronto and practiced there for 10 years. In 2020, Dr. Lakhoo received her diploma with the American Board of Lifestyle Medicine. She has also completed a course in body-mind medicine through the Center of Mind-Body Medicine. She has worked with many community clinics as well as large organizations to help implement chronic disease prevention programs with a focus on a holistic and multidisciplinary approach to care. She is passionate about empowering individuals to reach their optimal health and well-being through proven evidence-based lifestyle changes. Outside of her clinical work, she is also involved in lifestyle medicine teaching, research, and advocacy to help advance lifestyle medicine within primary care in Canada. Dr. Lakhoo, I'll hand it over to you.
Thank you so much, Safina, for that really nice introduction. So I will be talking about incorporating lifestyle changes for stroke prevention and treatment. And I'm really glad to follow on Shabbir's journey because it was really inspiring. So hopefully I'll touch a little bit more about all of these points in my talk, okay? So let's move on to the next slide. So this is a poll question. And I just wanted to ask, which of these conditions are risk factors for having a stroke? So number 1, high blood pressure, 2, high cholesterol, 3, obesity, 4, diabetes, 5, smoking, 6, all of the above. So Dr. Brar did touch upon this in her presentation. So the answer is 6, all of the above. So all of these 5 factors are the major modifiable risk factors for stroke prevention. And modifiable risk factors means you have some control to be able to modify these. And modifiable risk factors account for 80% of all strokes, as also Dr. Brar mentioned in her presentation. We also know that high blood pressure is a leading cause of stroke and one of the most significant controllable risk factors. So it's important to note that not everyone who has these conditions or risk factors will develop a stroke, just like not everyone who smokes will develop lung cancer. But the research clearly shows that having these risk factors will increase one's chance of developing a stroke. But the good news is that for many, incorporating lifestyle changes can reverse these conditions. And all of the lifestyle interventions I'll be talking about over the next few slides will help to reduce high blood pressure, high cholesterol, obesity, and diabetes. So really the prevention strategy is the same for all of these chronic conditions. And by preventing or treating these conditions, you can reduce your risk of having a stroke. So although improving your diet, increasing your activity, and living a healthy lifestyle can all decrease your risk for having a stroke, there are some risk factors that you cannot control. So things like age, gender, and race also play a role in stroke risk. So it's important for you to understand if you have predispositions as well that could make you more predisposed to having a stroke. So I really want to talk about the 6 pillars of lifestyle medicine, and you'll see these pillars talked about throughout, and I'm going to focus on a few of them. So the 6 pillars of lifestyle medicine really are focusing on consuming a whole food, plant-based diet as much as possible, engaging in regular physical activity, sleeping well, positive social connections, managing your stress, and avoiding risky substances such as alcohol and smoking. So let's focus on this plate right here. And I'm really happy to let you know as well that Canada's Food Guide has also updated their food guide, and this is the recent one. I believe it was updated in 2019. So here the Canada Food Guide does focus on half the plate of fruits and vegetables, quarter plate of protein, and they also encourage a lot more beans, lentils, and legumes as protein sources, and a quarter plate of whole grains. So instead of eating white rice, consuming brown rice or quinoa or whole grain bread is a better choice. And we know that improving diet will help lower cholesterol and blood pressure and help you maintain a healthy weight, which in turn will reduce the likelihood of having a stroke. So take a look at the Canada's Food Guide website. It also has the food guide available in many other languages. And I was looking at the II Canada website, and there's so much information about culturally preferred healthy foods. So I know a lot of people don't want to give up, the diet that they're used to eating. So there are many culturally preferred healthy food options, such as chana chaat and mung bean soup and mixed vegetable curry. So I took a look at the II Canada website, and the links are on this slide. There's also a great video on the site on heart disease, and this video has a lot of useful tips on preparing meals and some budget-friendly shopping tips and some very simple practical tips to help you eat better. So I encourage all of you to check out the II Canada website and the video on this slide. So let's keep moving. Everyone is talking about the benefits of physical activity, and that's because the benefits are numerous. So regular physical activity will help reduce cholesterol and blood pressure, which are the two biggest risk factors for stroke. So general guidelines are, aim for 30 minutes of moderate activity 5 days a week. You could do something very simple like a brisk walk or a bike ride with a friend, and that will help with your overall health. And a lot of people will also notice when they're engaged in physical activity, your mood improves, your energy improves, and it helps promote better sleep. A lot of my patients, when I counsel them on lifestyle medicine, they ask me, well, where do I start? And my answer is start anywhere. Start maybe doing an activity that you enjoy and start with something very simple. So if you've not been exercising, the key is to start with something simple and then gradually increase. The most important thing is that you start doing something most days of the week, and some exercise is better than none. So my advice is pick something that you think is manageable for you, that you enjoy, and stick with that, okay? That's the most important. I'm going to focus on sleep. So a lot of people might wonder, well, how is getting a restful sleep important for stroke prevention? Well, in fact, there's a lot of research now on sleep and the fact that getting enough good quality sleep is vital for chronic disease prevention. It helps maintain healthy weight, lowers your risk of diabetes and heart disease. And when you sleep better, in turn, you feel more rested. So you can probably make healthier choices, such as opting for healthier food. You might have more energy to engage in physical activity, and that in turn will help prevent further chronic disease. And I know in our busy lives, we often skip on sleep and we don't realize the huge detriment that chronic sleep deprivation has on our physical and mental health. So getting enough sleep will reduce our stress levels. It helps to reduce inflammation in our body. It boosts our immune system. So I really am a huge proponent on getting good quality restful sleep and prioritizing it. It will help prevent chronic illnesses, dementia, and strokes. Let's talk about social connection and stress management. There's, especially since the pandemic, a lot of focus on managing stress, and we saw the devastating consequences of being socially isolated during the pandemic. The benefits of stress management and positive nurturing social connections is huge on physical and mental health. And we also know that chronic stress, which has also increased significantly during and after the pandemic, has a huge negative impact on every system in our body, and it can worsen chronic disease. So I really encourage you to look at things that you enjoy doing and have some tools in your toolbox to help manage stress and create resiliency. We don't know what's going to happen in the future, the stressors that are going to happen in the future, but if we've got tools in our toolbox that we can turn to, that will help us when things get tough and help us to create resiliency. So these are just some examples on the slide of what some people like doing for stress management. And we know that also reducing chronic stress will help reduce blood pressure, help you improve your sleep, control your weight, and make you feel better. And it will also help to recover from stress, anxiety, and depression. So find a few things that you enjoy doing. For some people, it could be listening to music, cooking, walking in nature, meditation. Pick something that you enjoy and do it daily, even if it's for a few minutes a day, to help build that resiliency into your life and help keep your chronic stress levels as low as possible. So let's go to another poll question. Physical activity has the following benefits. It can lower cholesterol, lower blood pressure, improve mood, improve energy, improve sleep. Or does it only lower cholesterol and blood pressure? Or does it only improve mood, energy, and sleep? So the answer to that question is all of the above. Physical activity has so many numerous benefits on cholesterol, blood pressure, mood, energy, and sleep. So it's very important to try to incorporate that as much as possible. And which of the following can help manage stress? Going for a walk, spiritual practice, playing an instrument, spending time in nature, meeting a friend. And so the obvious answer is all of the above. And again, pick something that you enjoy doing. If playing an instrument stresses you out, that's not going to help manage your stress necessarily, but find something that resonates with you. And all of these are examples of things that can help manage your stress. So we talked a little bit about the lifestyle changes that we should incorporate in our life. But the key thing is that behavior change can be really challenging to implement. So I really want to focus the next part of my talk on some practical tips that can help you implement some of these changes. And when I see a patient in my lifestyle medicine clinic, I usually focus on, improving or incorporating some positive habits rather than removing a negative habit. So for example, let's say I have a patient who is smoking and they want to quit smoking, but they find it really difficult to do that. So I might instead focus on a positive habit they can incorporate. For example, if they're not exercising, but they want to start exercising and they think they can start doing it even slowly, then that is what we're going to focus on. And once some of these positive habits become part of the routine and you generally start to feel better, then perhaps is a time to go ahead and address some of the negative habits. So we want to continually look at that balance of incorporating more and more healthier habits. And I think what happens is eventually the body, it finds it easier to get rid of some of the more challenging habits. But the first, quote, I forgot about this quote. These are two quotes that I really like around habits. The first one is by Aristotle. We are what we repeatedly do. Excellence then is not an act, but a habit. And the second one is drop by drop is the water pot filled, from Buddha. And the first thing I ask my patients, and I'm going to ask you to think about when looking to change behavior, is ask yourself a very important question. What is your why? What is your motivation to change your lifestyle? And only you know this, and only you can answer that question. But it's a very important question to ask, and it's a very powerful one so that it can help you implement change. So some people might say, I want to feel better. I want to feel more relaxed. I want to be able to go on a hike with my family. I want to be able to play with my kids and my grandkids. I want to travel more. So ask yourself what your why is. And there's a really nice video I found on, I think it's Aga Canada site. I've included the link there. It's a compilation of people putting up signs of what motivates them. And it's a very cute video. I encourage you all to take a look at that and spend some time and think about why you want to make a certain behavior change. The second thing I want to talk about is creating a routine. In our busy lives, everyone wants to get to the finish line first. But we know that with sustainable changes, it's not a race. It's about slow, sustainable changes. Habit change is difficult. So if you try to implement more than one or two simple habits at a time, you could be setting yourself up for failure. So I really encourage you to keep it simple, take time to focus on the change, and give yourself the best chance for success. So start small, and let's say you want to start exercising. Start with maybe 5 or 10 minutes a day. Then as the change becomes part of your routine, it's easier to then increase the time spent on that habit. So if you decide you want to exercise and you haven't been, and you decide to go to the gym every day for an hour, you might find this overwhelming and stop exercising altogether. So I really encourage all of you to, if you're looking at making a change, start very small, go slow, and then add on. The second thing that I want to talk about is SMART goals. So, there's a lot of information out there available to us, and this can be very overwhelming. So with my patients, I really like to spend time talking about how to set goals into very small, bite-sized, actionable items that can be sustainable and make you feel less overwhelmed. So remember, if goals are not sustainable in your life, then it becomes very difficult to implement behavior change. So I cannot stress this point enough. The goals that you have to set are something that is going to be relatively easy to accomplish in your routine, something that you can sustain, and something you can measure. And they also have to be very relevant to your values. There's no point setting a goal if you don't align with that goal and doesn't reflect your values. And we want something that's going to be realistic and help with motivation. So I'll give you an example. Let's say I have a patient who wants to make some dietary changes, and their goal is going to be adding more plant-based meals in their diet. So a specific way of framing that could be, I want to eat home-cooked plant-based meals 4 times a week during the weekday. So from Monday to Friday, I want to have 4 plant-based meals. Okay, so how are we going to measure that? Well, we can measure it because have we had those 4 plant-based meals in a week or have we not? So that's easy to measure. The next thing is, can you achieve this? So you have to think about how are we going to achieve this goal? If you're coming home from work at the end of a busy day and you don't have any vegetables in the house, you don't have any legumes, how are you going to eat this? So something that you could think about is maybe I batch cook 1 or 2 different meals on the weekend and have that in the fridge so that I can eat home-cooked plant-based meals. And is this relevant to you? Well, it's going to be relevant to you if, let's say, you want to improve your nutrition, your health, or energy. So pick something that's relevant to you. And can you look at it and say, is this time-based? So you could say, I want to achieve this goal in the next 4 weeks or the next 8 weeks. And then when 4 to 8 weeks come, you can come back and evaluate it and see if you've achieved that goal. And then you can add on. So SMART goals are a really good way of setting small goals that are simple and easy to follow. So definitely take a look at SMART goals. And the other thing is finding a friend or finding many friends. We know how important it is to have a support system. The research shows that people that have others to support them in changing a behavior have better outcomes and are better able to sustain their changes. So write these people into your plan. If you don't have a huge community, online forums are a great tool as well, but don't underestimate the power of support. So ask for help, get a friend, a family member, a coworker to help support your goal. And, remember to connect with community. So we know that individuals who are connected to community have a better sense of purpose, have a good support system, and have a better health outcome in general. So, reconnecting with community that you are a part of, finding people in common who have common interests and goals can really help in achieving your goals. So you could, find a community and do a cooking class together, or have people over and do a vegetarian meal together. You could engage in your community and, this picture shows, I think, building a house together, going for a walk together. So really, I want to touch base on the importance of connecting with community because you can learn from each other. It's a good social source of social support, and you can have fun while you're achieving your goal. And then have a coach. So coaching can come in a variety of ways. A coach can be a friend, it could be a mentor, it could be a healthcare professional. And these days, there's a lot of coaching apps as well, such as, MyFitnessPal. So whoever it is, whatever it is that you use as a coach can help you to encourage you, to help motivate you, to prevent some, barriers or overcome some barriers. And a coach can help you feel accountable and motivate you. So in an ideal world, everyone should have a coach. And if you prefer technology, then take a look at some of the great coaching apps that can help you stay on track as well. So poll question again. The following will help with behavior change. So this is true or false, okay? Number 1, making specific goals. Number 2, making many different changes at once. Number 3, making sustainable changes. Number 4, making a change because others told you to. Or 5, making the behavior part of your routine. So this is going back to the slides I just talked about and the SMART goals. So, really focusing on making specific goals. You don't want to make different changes at once. You want to try 1 or 2 things and be very sustainable with that. And you don't really want to make changes because others told you to. So it's good if other people encourage you or suggest changes, but really that motivation has to come from you. And that's, again, coming back to asking yourself why it is you want to make a particular change. And again, making the behavior part of your routine is very important. So the last few slides, I just want to focus on 5 to Thrive. 5 to Thrive is a chronic disease prevention program through II Canada and really focuses on the same pillars that I've talked about. So, eating healthy, meaningful movement, staying positive, connecting with community, and de-stressing. I had no idea the wealth of information that was available on this site. So I really encourage all of you to take a look at the site. It has a lot of information on simple, practical, culturally relevant tips, and that can help you make some of the changes. So the links are on the slide if you want to take a look at 5 to Thrive. And I also wanted to share this slide as well, where Maulana Hazrat Imam says in December 2015, we are more and more confronted in modern society by non-communicable disease, and therefore in the decades ahead, we will be concentrating through the Aga Khan Health Network and other medical institutions in dealing with non-communicable diseases. And I refer to diabetes, hypertension, cardiovascular disease, mental and neurological illness, cancer, and others. These are the areas where we must concentrate properly to serve future generations of society. So something really important there. And I, in conclusion, want to say that, the lifestyle changes we discussed are not only for stroke prevention, but important for the prevention and treatment for, most chronic diseases, if not all, such as hypertension, diabetes, cardiovascular disease, and cancer. And so by incorporating these changes into your lives, not only will you be reducing the risk of getting a stroke, but in turn, you'll be reducing your risk of getting other chronic illnesses. And also to remember that even if you already have hypertension, if you have diabetes or heart disease, you can still use these lifestyle changes to better manage these conditions and prevent worsening of these conditions. So if you look at our Canadian guidelines on hypertension and diabetes, they all have lifestyle interventions as the first and foremost change that individuals should implement, either before adding medication or at the same time as adding medications. So lifestyle changes can be implemented even if you do have these conditions to help better manage them and prevent worsening, okay? And I also wanted to add that these lifestyle changes are the way of living in many communities, such as those in blue zones around the world. So what I've talked about in these slides is not a new idea, right? This is how a lot of our elders lived and how many still live today in the world. However, if we live in busy cities, North America and globally, this can pull us away from the ways of living simply. It can be very challenging to engage with others, to connect with nature, to slow down, to take time for reflection and incorporate movement into our busy lives. So I really encourage us all to be kind to ourselves, to view each day as a new day that we can start to implement some of these changes and continue with positive changes we make. So remember that change is never linear. It's the small changes implemented consistently that will result in lasting changes. So I'll just end with these 2 quotes. Our genes are a predisposition, but our genes are not our fate, I wrote to him. If they were, then you'd be a victim, but you're not. You're one of the most powerful people on the planet. And that's a quote by Dean Ornish, who is a founding father of lifestyle medicine. And the second quote, genes are not destiny. They might define some of your physical features and give you a tiny head start on some things, but your lifestyle, your beliefs, and your hard work are much more important, by Jamie LaFay. So thank you again for inviting me to give this presentation. I hope you found it really helpful, and I'll conclude there. Thank you.
Thank you so much, Dr. Lakhoo, for sharing all of that with us. It was definitely helpful to hear more about how can we adapt our lifestyles to prevent stroke and cardiovascular disease. I think it was really helpful that you left us with those quotes at the end around genes and just really keeping that hope in mind, right? That we can make those small, sustainable changes that will add up in the long term. So thank you so much for that. Before we wrap up, I would like to ask each of our panelists to come back and share one final word or piece of advice, something that they want to leave the group with in closing out. And so maybe we will start with Dr. Brar.
Hi, guys. Thanks for having me for the talk. I think my one piece of advice would be is that primary prevention is really the best prevention. So really try to take control of the risks that we can control. 80% of these strokes are preventable. Dr. Lakhoo went over a lot of good tips, and all those things are like not only stroke reduction, heart attack reduction, dementia reduction. I know it feels like a lot of work, but the quality of life that you'll have, the energy, the sleep, it'll be amazing and definitely worth it.
Thank you for sharing that. Definitely helpful to keep in mind. Dr. Lakhoo, over to you.
So I just want to say it's never too late. It's never too late to make a change. So every day is a new day. Start small. And, people say if you fall off the wagon, the next day is a brand new day. You just keep on starting. So that's what I would end with. Don't be too hard on yourself. Take each day as it comes. And yeah, it's really never too late to make those changes.
I like that. Thanks for sharing that. And Shabbir, over to you.
First and foremost, trust your instinct and get help right away. That is very critical. Secondly, is keep your blood pressure in check. And I do that by going to the gym. The gym will not only help with the blood pressure, but also increase your HDL, which is your good cholesterol. And while you're at the gym, I would recommend don't skip the warm-up or the cool-down exercises, as they do help with lessening injuries. And lastly, if you're ever in a position of having a stroke, my recommendation is to go very, very, very hard with rehabilitation. Don't leave anything on the table whatsoever. Give 100%. And there's one thing about neuroplasticity. It can go on for years. But I found that the most improvement was in the earlier stages. So go very hard and go early. It would be my recommendation.
Amazing. Thank you for sharing that with us. So this brings us to the end of today's webinar. I want to thank all of our panelists again for joining us. So thank you so much, Dr. Brar, for the fantastic information that you shared, Dr. Lakhoo for all those lifestyle changes, and Shabbir for sharing your personal journey with us. So a big thank you to all of you. And thank you to all of you for joining us today. We really hope that you found this valuable, and we hope that you'll take these insights back to your friends and family, and that you can incorporate these changes for a healthier lifestyle. We kindly ask that you take a couple of minutes to fill out an evaluation for the session. The feedback we receive is really important in allowing us to determine how these webinars are helpful and how we can shape these in the future to include different topics and different speakers. Finally, I'd like to invite everyone to join us for future sessions in the series about Your Health is Your Wealth. So please keep an eye out for those. And you can also visit iacanada.org to view previous webinars and learn more about 5 to Thrive. If you require any support or resources regarding your own health, you can contact the Health Navigation Service through the Access line. And that's all. Thank you again for joining us in Yali with us.